Welcome. Good morning and welcome. My name is Karen Reimers and I'm the current president of the Rotary eClub of Florida. And it's my great pleasure today to welcome our guest speaker, Nathalie Pratt, from the WASH with Pure Water for the World. She is the executive director of WASH, which stands for Water, Sanitation and Hygiene. And the WASH partners with rural and underserved communities where there are high incidences of waterborne diseases and a scarcity of aid. And together, they establish comprehensive safe water solutions that include essential tools and education to serve all community members. So they do education, capacity building programs, training, other organizations, and all of this is to accelerate access to safe water and sanitation for all. They also monitor their projects and programs delivered to ensure that they're effective and sustainable. So without further ado, I'd like to welcome our guest speaker, Nathalie Pratt.
Well, thank you very much. And thank you, like I said earlier, for having me today and for allowing me the opportunity to speak with your club. What I'm going to share, and I'll go ahead and put up a presentation here in a minute, but what I'm going to share is that both my initial association with Pure Water for the World, as well as the organization as a whole, was actually started through Rotary. So Pure Water for the World was birthed by a passionate Rotarian out of Brattleboro, Vermont, who went down to do some dental work in El Salvador and quickly was faced with the fact of not having access to clean water. He was so passionate that he went back to his club and got a group of people motivated to help him make a difference. That was back in the early 1990s. About 1999, the project outgrew the club's capacity to continue to manage it itself, and Pure Water for the World rolled off into its own 501c3 nonprofit organization. So my actual initial involvement with Pure Water for the World also came through Rotary. I have an aunt who is a Rotarian out of Wyoming. After the earthquake in Haiti back in 2010, she was looking for an organization to get involved with to go make a difference, found Pure Water for the World as a Rotary founded organization, and came back and said to me, you got to get involved. You got to come and see what's happening down here. So I went down as a volunteer with the organization to check out and see what Pure Water for the World was up to in Haiti. And similar to her, it got into my heart quickly, and I've been involved with the organization ever since. I initially started helping through volunteerism and then came on to help them with marketing, communications, and strategic development, and have only recently stepped in to take on the roles and responsibilities of the executive director. So that gives a little bit of background about the organization and myself. I'm going to go ahead and share my screen so that you can, hopefully we'll share it. There we go. So that you can see a little bit about what Pure Water for the World is up to, both now during the days of COVID, because things have certainly changed, as well as a bit more of what our history has looked like. So a lot of this I've already touched upon. Our headquarters today are actually in Rutland, Vermont, so just down the road from Brattleboro, and we have offices in both Tegucigalpa, as well as in the small rural communities of Troas and Marita Honduras. And we also have an office in Port-au-Prince, Haiti. And through the years, we've reached over about 750,000 people with safe water programs over the last 22 years. We have started, and Karen alluded to this, but essentially our mission is that we want to provide people with the access to life's most basic necessities, safe water and sanitation. And initially we started through the process of providing safe water tools. What we learned quickly is that in addition to having the tools, there had to be an element of education and hygiene education to really be able to have continued safe water. So we have built through the last 22 plus years upon the idea of we have to go well beyond just the tool, because it's the education that allows the tools to function properly and really create sustainable results. So a lot of Rotarians are very familiar with this. I know WASH is a huge initiative within Rotary, but to see these statistics always still even today when I look at them is pretty stunning in 2021, that we're still looking at over 2 billion people who lack access to safely managed drinking water, over 4 billion people who have no way to safely manage their sanitation, and over 3 billion people, especially in a time of COVID, that still lack access to having basic hand washing facilities at home. And the result of this, as we unfortunately know, is that there are a lot of deaths every year. Primarily, the majority of them are under the age of 5, for directly attributed to diarrhea and unsafe water, sanitation, and hygiene practices. So this is a fellow Rotarian from the Tampa area, actually. This is Eric Johnson. Eric leads our volunteer trips down to Honduras. Unfortunately, those have been put on hold over the last year, but we're hoping to get them back up, if not this fall, certainly by 2022. I want to show this video that Eric put together primarily because I want you to see what the water that these families and schools are faced with actually looks like. So let me know, sometimes for whatever reason, when I show this and share my screen, the audio doesn't come through. So just let me know if it's not coming through.
Sorry, I think the video's not working, Natalie. It's kind of choppy and there's no audio.
Okay, you can't hear the audio? Okay, okay. Well, let me just kind of basically tell you what Eric's saying. Eric's basically saying that this is a community in Marita, Honduras, where Pure Water for the World is just beginning to work. When he points in the back direction, he's showing where the latrines are. They're sort of not well done latrines that are quite old, where the children have to use the restroom when they're at school. But more importantly, he's going to show what the water looks like, not only that they're washing their hands with, but the same water that these kids are drinking at school. And so what he goes on to say is, you know, I would wash my hands with this, but there's no way I'm going to drink it. And so this is what our challenge is. Our challenge is to go into different communities and say, what are the individual needs of the community, and what do we have so that the kids and families are not drinking water and using water that looks like this. Take you back one, sorry. So I like to think of Pure Water for the World in terms of 2 areas where we really focus. One is a direct implementation. We go into a community, well, communities come to us, they say, you know, we'd like to get involved, we really need clean water. And we say, okay, great, we'll do this as a community, a collaborative effort. It's definitely a partnership. We expect community members to own their water and sanitation projects. And so they are very integrated into the process and very integrated into the decision of what is needed for the community. We work with local government, we work with local leaders, we work with individual leaders within the community, and we develop a program that meets their needs. We work with individual homes, schools, and healthcare facilities. And I'm going to show a little bit about what an implementation program might look like, again, depending on the needs of the individual community. But in addition to a direct implementation model, we also have a WASH training and consulting arm. So the idea behind this started when we were approached by an organization called COST, the Center for Affordable Water and Sanitation Technologies out of Canada. COST is an amazing train-the-trainer organization who identified Pure Water for the World as an organization that they could work with to provide this train-the-trainer opportunity for other organizations. So essentially what we have the ability to do is we have a WASH consulting arm that teaches other NGOs or teaches teachers or government entities or businesses how to integrate safe water and sanitation programs into their own communities. And the implication from that is that we have the ability to accelerate the access because we have way more reach by going through a train-the-trainer program than we're ever going to be able to do alone. So the impact is significantly larger. Our WASH implementation program, and this is kind of a busy slide, and it's not my favorite in terms of like how busy it is, but what it does is it shows, I think it really beautifully demonstrates what goes into a safe glass of water. So we'd like to think, you know, it'd be nice to just have a filter that gives a safe glass of water and is going to be sustainable. The problem that we've learned through our own trial and error is there are so many elements that have to go into a safe water program in order for it to really demonstrate strong results year after year after year. When we go into a community, and many times you'll hear, well, how much does it cost to sponsor clean water for a year? Well, we don't want clean water for a year. We want clean water for a lifetime. So when we go into a community, we look at what are the tools that the community needs. What's their water source? Do they have the ability to use like a point of use water filter, like a biosand water filter, which I'll show you an example of what that is in a moment. Is there rainwater harvesting solutions in this community? Do they have enough rainwater? Are there community water systems that we can develop? Is there a water table that enables us to do that? Do we need to do some piping, especially from the water source to the school, so that our kids aren't walking and spending the majority of their day collecting water? They're actually learning in school. From a sanitation perspective, we're looking at what does this landscape look like? What are families faced with? What is their sanitation program right now? Many of the families that we work with are faced with no options, and there's open defecation that's being practiced widely. So our practice is to go in and provide latrine solutions that work for them. With schools, we always offer gender-specific latrines, and this goes hand in hand with our education program. We want our girls in particular to have an opportunity to manage their menstrual cycle in a way that's private, and that they're able to do it at school so that they're not missing school every month. So we teach a menstrual hygiene education program supported by gender-specific latrines that give girls the privacy that they need in order to stay in school through their menstrual cycles. In healthcare facilities, it's very similar, and it's actually an area that is burgeoning for us. We're continuing to advance our programs in healthcare facilities, which has really been a result of a lot of what's happened through the last year with COVID-19. But to me, that you have the tools, and as I said earlier, the education, because the tools are the tools, but without the proper practices, the tools will only last for so long. So we're looking at transforming behavior over time for generations to come. And by that, it means teaching everything from water source protection techniques to environmental hygiene, to home hygiene, to personal hygiene. How do we wash our hands properly? And I know all of us have seen videos over the last year about how to properly wash your hands. When you don't have a hand washing facility at home, this becomes very complicated. So working with families to have those facilities available to them and then know how to properly do it. It's not handed down from generation to generation traditionally, but we're going to provide them with the practices to do that in the future. And then menstrual hygiene management. It's a huge area where we are really about empowering girls and women so that they understand why this happens, how it happens, and how they can manage it effectively. And this is everything from how the body works to how to build reusable supplies so that you're not having to figure out how to manage it every month. We do a wide range of teacher training where we're actually providing teachers with information that they can integrate into their existing curriculum. The teachers, like here, have very heavy curriculums, and to add WASH concepts on top of their existing curriculum was something we learned quickly wasn't going to work. So we figured out how to teach them how to integrate it into their existing curriculum. And that's something that we've been working closely, especially in Honduras and with the Honduran government, about how to do that at a national level. And then sustainability measures means that we have to be integrated into this system. It can't be Pure Water for the World dropping off a program and leaving. It has to be that this entire package is woven into the community, and that's everything from the leadership that I talked about to local government. We work with what's called community agents, and community agents are volunteers within the community that are going to be Pure Water for the World's feet in the community. They're the eyes and ears within the community that are taking responsibility for their local project, ensuring that the practices are being employed and that the tools are being used effectively and sustainably. And we do long-term monitoring and evaluation to make sure that we're testing, finding areas that need improvement, and knowing what's working and what isn't working. So this is an example of a biosand water filter. For just a brief way on how this works, this is essentially, there are no moving parts, there's no electricity, there's no requirement down the road to replace different parts. These are tested for up to 20 years, but there's no belief that there is going to be a residual change after that 20-year period. It just hasn't been tested beyond that. We have layers of gravel, 2 different layers of gravel on the bottom that's then covered by a large layer of sand. Water is poured in through the top over a period of time within the first 48 hours, but really over the first 2 weeks is when the strong bio layer develops within this biosand filter, natural layer that develops and pulls the bad viruses, bacteria, the E. coli's, the choleras out of the water and gets rid of them, but it leaves the good minerals in, so that children that are in particular that are developing are not losing the minerals through the process of using the biosand filter, but we are removing the pathogens that are in the water. These are a couple of examples of latrines and hand washing stations. The one on the left, it's at a school, so you can see it's 2 doors. These are small rural schools, probably 25 to 30 students, depending on the area. These are poor flush latrines, but the one on the right is a home latrine. Now, what I want to make sure that you understand is that when we go and do a latrine at a family home, Pure Water for the World staff doesn't go in and build that latrine. What they do is provide the education about how to effectively build it and the guidance along the way to make sure that the family is building it correctly so that it's going to be there effectively for years to come. What we hear is that, you know, a family learned how to build their latrine and now their child has grown up and is building the home next door to them, and all of a sudden that family has a brand new latrine because they already know how to do it themselves and they know how to properly manage it. So it's, again, we're looking for those generational impacts. And one thing I didn't mention in terms of Pure Water for the World staffing, our staff are local to the communities that they serve. Our staff, as 90% of our staff are residents of in-country serving the communities where they live and work. So they have a significant relationship within their own communities. Here's an example of a school in Haiti. The schools in Haiti where we work tend to be much more heavily populated. So there may be 2, there may be 4 stalls. This side has a side for girls and a side for boys. But again, the concept is providing comprehensive water sanitation and hygiene education. Here is a wash station at a medical clinic in northern Haiti. We actually just finished this about a week and a half ago. And I was stunned at how beautiful it looked at the end, because this was the first time we've actually built a shower. So this is a birthing center that's being built in up in the Pistère area of Haiti, in northern Haiti, and they needed a wash station. And so as our team developed pictures for us, I was stunned with how beautiful and well done it was. But this will serve both a medical clinic and a new birthing center for an entire area, and will allow them. Right now they've been having to practice open defecation, and so this will completely eliminate that practice. Water sourcing is, I've already mentioned, but it's a very big piece of what we do. On the left, that's an example of bringing water from the source to the schools so that kids aren't spending time walking to water sources every day. They're learning in the classroom. And education, I think I've hit on that. Water is safe when the people understand the roles that education and hygiene practices take. And monitoring and evaluation, all of our projects are monitored and evaluation at regular intervals so that we know over time that we're making sustainable impact. Our wash training and consulting program offers a wide variety of different training techniques programs that can be involved with different NGOs. So it can be something as simple as how do you build a biosand water filter for a community, to how do we integrate the different wash techniques into our school curriculum. And so I think the team's up to about 15 programs now that they're teaching, but in a continue growing depending on the needs of the communities that are looking for the different types of training. So a little bit about our history with Rotary specifically. I mentioned our birth with Rotary, but also our continued activity. So about 50% of our board members today are still very active Rotarians. Through the years, we've been supported by more than 500 different Rotary clubs We're considered an implementer in both Central America and in Haiti, and we have significant local Rotarian involvement in both of those areas. We've successfully implemented 34 Rotary grants totaling over $3 million. We've reached over 160,000 people, 320 schools, with more than 28,000 biosand water filters installed and over 1,700 latrines as a result of Rotarian projects. We currently have 3 global grants in process, a district grant, and we are also participating as a trainer in Guatemala for a project that's part of the Wash in Schools initiative with Rotary. A large number of our volunteers and many of those who visit us with us in country are Rotarians, and so our Rotary Foundation is still very strong. Our current projects in Haiti include one of the global grants is a 400 family home project in the Pistère area. So that same area where you just saw that beautiful wash station is an area where we're also working. We did a pilot project of 100 families about 2 years ago. This was actually, I was able to take these photos just over a year ago when I was last in Haiti. These were families that participated in that 100 family pilot project to see whether or not that this was a new area for us to be working. And I think you can tell by their faces, it's been a very successful program for them. So we're excited to be back up there again. These are just we also have a couple of large community schools that we're working on. We actually have a fundraiser, a passionate fundraiser right now who's matching donations to fund the second one. This is in Leogon. Leogon is where the epicenter of the earthquake was. And so providing schools with the facilities that they need in order, again, to keep their kids in school. In Honduras, we have been working in Troas, Honduras since 2009. There are over 300 sub-communities, so tiny little communities within the larger region of Troas. We've reached about just over 150 of those communities. That program has grown from starting again as how do we provide water filters to adding all of the layers of education that we've learned along the way. Troas is located along the Nicaraguan border down in the southeastern side of Honduras. This is a brand new community for us. We've just started back in 2019. It is Marita. This was a government coming to us, the local government, saying, we understand the work you've done in Troas, and can you please expand into our area? The need is great in this area, and so we are excited to have launched programs in this area now, and we've continued working all through COVID. Unfortunately, we did have a little hiccup in the fall when the 2 massive hurricanes struck right through the community of Troas, where much of the Pure Water for the World team lives and works. So we've had to shift to emergency response. And so the first part of our year has continued to be responding to emergency relief. Our country director in Honduras is a very active Rotarian. And so she was able to get Rotary to be an active part of our hurricane response efforts as well, the local Rotary clubs. So a lot of people want to know how COVID has impacted our work, and I'm really grateful to be able to say that we have not stopped working as a result of COVID. Our local relationships with government allowed us to be designated as essential workers from the very beginning, and we were able to quickly pivot and say, how can we take our existing work, all of this layers of education that we do, and utilize it to help with COVID prevention? So we've been teaching families for years how to safely wash their hands, adding in how to safely wear masks and socially distance with a natural fit. And we were brought in to help develop different trainings, to work with local health centers, these are emergency response latrines that were built in different areas so that there were additional places for people to safely use restrooms. The hand washing station in the middle was actually designed by one of our staff members so that it had a foot pedal to continue to try and present low touch options for washing hands. We went around with Bullhorns in Haiti, and we provided television advertising and radio spots about the importance of healthy hand washing and hygiene practices. we developed videos, and including in those videos were how to build effective tippy taps. So on the right there, you'll see a tippy tap, and that's essentially for those who don't have access to hand washing facilities. How can we easily take something in our own backyard and provide a hand washing system? Those videos have been picked up. We've published them on our website, and they've been picked up all over Central America and the Caribbean. So we've gotten reports far and wide that those videos were used to provide building of construction of tippy taps in many, many small regions across those areas. So how can Rotary, as Rotarians get involved? There's always opportunities to sponsor different projects and fund wash projects if that's something that you're interested in doing. We also invite you to take part in the action. So unfortunately right now, traveling isn't something that we're able to offer, but as soon as we are able to, traveling with Pure Water for the World to Honduras and or Haiti really gives you a sense of what happens when your feet are on the ground and you really get to see what's happening in action. And then we're a small organization. We're still small and nimble and grassroots. And so we look to people who are involved with us to help us spread the word so that we can let more people know about this important work and how to get involved and really create a difference for these families. So I welcome any questions that you have. I know that was a lot to cover, so hopefully I didn't go too fast, but I'm happy to answer any questions.
Nathalie, what you don't know and what probably the other members in the club don't know is I've been funding it for a long time. Oil for Water, George Lewis, he didn't even know, but I had taken his paintings and put them into a book and surprised him with the book. And I have donated thousands of dollars, all the proceeds. I didn't even take any costs out. And when people buy the book, and then I started the Facebook page, Oil for Water on Facebook, and I share all of his paintings. You know the George Lewis paintings, don't you?
Uh-huh.
Okay, I made the books, paper and hard copy, and then I share all of his paintings onto the Oil for Water Facebook pages. And I have sent to the grants, I think I've sent, one time I wrote a $1,500 check out of my donor advised fund to Guatemala, and several others. So in the name of our club, or in the name of the project, everybody should like on Facebook, the Oil for Water /polio. But every time we turn around, and in here are wash projects, there are bathrooms in here, or wash stations, and pictures of very awful water. I came from a farm, so we had outhouses that I used every day. And these younger people in this meeting have never probably used one. Well, Logan's probably used them in Haiti, but it's a love of mine. Here's some pictures back here of some Haitian children using a wash sink. And then there's George up there with one of his most prolific painting there.
That's fantastic.
So yes, I can even make more. This was, like I said, I took some of his pictures and some artwork and made this book, and he didn't even know it, that it was coming. But yes, and it's still available. You can find it online on Amazon. And I will be glad we could restructure a new book and put something together, even a coloring book or anything else, a lesson book that could then be reproduced to teach with if anyone wants. And then all the proceeds again could be used towards a wash project.
That's amazing. Thank you so much. That is really beautiful. I love the creativity that comes out of people getting involved in water.
Yeah, that's amazing. Thank you so much, Dr. O. I think it's a great example of Dr. O's tireless work behind the scenes to promote all of these worthwhile projects. And thanks again for all your service to the club, Dr. O.
Thank you.
Yeah, I learned so much from your presentation, Nathalie. I really wasn't aware of how comprehensive it is with water, and I never really thought about it that much before today, how many aspects there are to the clean water, how much it affects population health at every level. And I was just wondering how you go about the process of determining how to prioritize which elements in which community. Do you just ask the locals what they are looking for, or do you do some kind of interview or a structured assessment? How do you figure out which of the many different facets to implement first?
That's a great question. So initially, back when we went into, for example, like the Troas region of Honduras, we went in because UNICEF provided us with a grant. They identified it as a high need area and they had funding that was designated for that. We initially started with a couple handfuls of communities that we were serving. And what ended up happening was what happens in small communities. Now, this is a community where truly homes are, you can't see one home from another. You're walking on pathways of dirt to get to one home to another, but it might take you 20 minutes of walking through somebody's coffee field or banana plantation in order to get from one home to another. But what ended up happening was people were hearing, "Oh, my kids aren't sick anymore," or we're not having issues with death among small children was a big issue in this area. And it grew in this momentum. And so we started having communities come to us to say, how do we get on the list? So, and that's essentially how we've grown from there in both areas. While donor funds certainly have enabled our ability to go into communities, we want to know that there is a need that exists. We also want to know that the community is committed to it. So it can't be us providing them with a solution. It has to be that the community wants this, that they're willing to invest in it. They're willing to invest sweat equity in it. They're willing to be volunteers within it. They're willing to participate. They all are required to participate in all the levels of hygiene education. They do not get their filters and their trainings without participating in the hygiene levels. And we want them to stay on long-term, helping us with monitoring and evaluation. So we may have a community that comes to us, community leaders that come to us and say, we really want to do this, but our next steps is to say, okay, how much are you willing to step into this? We'll also look at what are the needs within the community. What does the health center say? What kind of rates of diarrheal disease do they have? What does the health center know, and some of them don't know, in terms of what pathogens are existing in the water, and what does their water source look like? So we don't do wells. We might partner with others who do wells, but if they don't have a water source, we have to be able to look to say, how can they gain a water source? Is that something we can do through partnership or another way? So it's looking at a variety of factors depending on the community, but it's really the biggest pieces of the community has to want this to be, they have to want it, and they have to be willing to own it when we are finished. So that we can go back there 3 years from now and still see it working effectively.
Yeah, so it's a very complex process, sounds like, to really make the practical decisions about where to start, but you might have the overarching goal that really comes from the community, like reducing the infant mortality, for example. If that's where their motivation is, then you'll kind of target interventions that really play into that first. And then maybe go to all the other many facets down the road.
Yes, and most of these communities that we work in have some level of a local community school that may or may not have any way to manage water and sanitation at their own school. So we may, we'll look at what are all of the areas within that individual community to see what is it that we can offer, what is it that they need, and do we have a nice fit together? So that's kind of the short answer.
Mm-hmm. Oh, thank you. Yeah, I can only imagine how all the expertise and experience from your team is so essential to really make this work. Yeah,
absolutely.
Well, thanks for explaining that.
I had a quick question too. First off, obviously, thank you so much for presenting. I think it's awesome what you guys are doing, and having personally worked in Haiti for so long and going back shortly, I think it's absolutely phenomenal. I was really intrigued with the education component of the grant too. I was wondering if you could kind of speak a little bit more in regards to that, and specifically who is the one delivering the education. I know you said definitely teachers, and they kind of integrate that in the curriculum, so I think that's phenomenal. But outside of schools, are these kind of those volunteer community agents, or just local Rotarians, are probably just a conglomerate of all these different types? So yeah.
Sure. So we have a team of our own Pure Water for the World team members who are local Haitian and Hondurans. These team members, and in fact, in Honduras specifically, our Haitian team members, many of them went on to some type of college, but the Honduran team members will tell you that they've learned how their job through the University of Pure Water for the World. So thankfully, with our partnership with COST, this organization out of Canada, our team members have become certified trainers. So in that, they learn how to provide interactive training so that it's really a hands-on training approach, which certainly provides some level of challenges in COVID. The team in Honduras actually has pivoted and taken all of their programs online. So when people have access to internet, which not all people do, they're able to, especially with teachers, they're able to pivot those online. But it is the Pure Water for the World team who's providing those training programs. These are certified trainers, certified teachers from primarily from COST, and then we've supplemented COST trainings with some of our own things that we've learned along the way and established our own training programs through our teams, our WASH training and consulting teams. So for example, in the 400 family project in the northern part of Haiti right now, we have 2 team members who are up there training every single day. We actually have 4 team members who are up there, but 2 who are in charge up there. They've actually trained a local person who will continue to carry it on. She's actually a health promoter. And she'll continue to carry it on long after we are there. And then we'll also provide additional community agent training. Now, the community agents in Haiti will learn how to support the individual projects. But what we're doing in Honduras and experimenting with, because we've been in these, particularly in TROAS for so long, is we've learned that these volunteers have gotten so well adept at talking about water and sanitation and the importance of the education pieces to that they want to carry on. So we're actually adding in a health promoter project, a health promoter training for them, where they might have the ability from their local government to make money as a health promoter in their own region. And they might add into that additional things from the local government that they might, beyond water and sanitation. Now, our education incorporates quite a bit, including menstrual hygiene education, which partners well with local health associates, because they want to be able to see all of these pieces added in. But what we're learning is they can also teach about other food scarcity issues. They can teach about how to protect their homes, in the event of damage to their homes in whatever way. So it's really giving the locals a skill set that is marketable down the way.
Yeah, awesome. Thank you. I think it's important to empower those community members and kind of give them that the education for which, they're subsequently, not only impacting their immediate community, but it seems like it's kind of a generational thing too, and they really take it to heart. So I think that's awesome.
That really is the goal, the generations.
I'm sorry. Rotary used to have a sustainability problem in some communities with global grants, and they would find just 10 years ago that when they would do a project, they'd go out there, they'd set the project down, and sometimes they wouldn't even, and this goes with projects all over the world, not just with Rotary, is they'd go out and they'd plop a project down, and they may not have evaluated whether the people wanted it or not, or they would go out and help. Americans, Western society says, oh, you need this because we like it, and go and do it for them and find out, oh, you don't want these clothes because they aren't appropriate for you or whatever. And I remember seeing when Rotary came out with a sustainability model for the global grants, is that we had to make sure that it was going to be continued for 5 years and that it had to be work. And I saw one example was the privies that were, when they returned a year later, they were being used for chicken coops.
Yep.
And so how long are y'all maintaining that? You got my Southern going there, y'all. How many years are you maintaining and supervising to make sure that sustainability is going on with your projects?
So formally, because we've actually seen the same things. So formally, we're following, the idea, the same. We've been doing monitoring and evaluation for years, but it's only been more recently that we've really established our more formal process that is in alignment with what Rotary has taken in this 5-year piece. Informally, we continue to visit these communities, because you have to remember our staff is local. So we continue to visit these communities on a regular basis long after that 5-year period, so that we're still taking a look and seeing, are things still showing? Are we still looking at progress? We've actually recently revamped our monitoring and evaluation process so that there's a learning component to it that's more direct, so that we're really looking at apples to apples over time, and we're able to say, what are the really big impacts that we're seeing over time, and by that I mean from a health center perspective. We know through conversations with health providers that when we've provided service in a community, I've had health providers say to us, I no longer have to deal with urgent diarrheal disease issues. I now have the ability to talk about long-term health care as opposed to acute short-term challenges that community members are facing. But that's anecdotal. So our goal is we've just launched this new program so that we're really incorporating these multiple facets into how we're looking at data long-term and capturing those anecdotal stories in a more data-driven way, so that we're demonstrating through 5 years, but even beyond that, how communities are actually seeing transformation. But you're right. I mean, I had a story once in Haiti. One of our community health promoters or one of our staff members was going into a community health promoter's home and saw the exact same filter that we were bringing into these homes sitting in the corner of the home. And he said, well, what's this? You've got the same filter already. And they said, oh yeah, somebody dropped that off at some point. Again, really well-meaning, right? We're going to provide this biosand filter. We're going to give these people access to clean water, but they didn't really know how to put it together, and it was filled with bananas. So it was a great resource for them in terms of being able to provide, store something, but that certainly wasn't the intention behind it. So it really, I think the shift for the entire wash sector, and it has just been that, demonstrating sustainable results, so that we're not going in, installing filters and even installing filters and providing the education, but then not staying connected with the community long time. And we've been doing the community agent program for as long as I've been with the organization, which has been over 8 years now. So it's a program that continues to evolve, because community, especially in Honduras, we find it, the community agents are just hungry for more information. They want to be those leaders. They want to see transformational change in their communities. They want to own their water projects. They want to have this knowledge of how to keep their families and their children safe. And so it's been really fun to be able to watch the growth of this program over time. Yeah. It's interesting, Logan, when I got involved with Pure Water for the World on my very first trip to Haiti, we were in Budachita, Haiti, which I don't know if you know where that is, outside of Leogane. And our country director at the time, I'm a really hands-on person. So I said, I gotta feel and touch this project. You can't just tell me what it's about. So he said, would you like to install a water filter? And I said, yes, that would be fantastic. And so I went into this home, and when I went, I came from a nonprofit before that corporate world, and water wasn't something that I was always thinking about. I've traveled a lot. I've certainly been to places where I've had to consider what I'm doing in terms of consuming and using local water, but it wasn't something that I was immersed in. So here I am in this woman's home, and her child is standing there, and they're explaining to me the different layers of gravel and sand and how they work together and how I can do this. And I put together my very first biosand filter. And I remember one of our staff members turning to me and saying, this is the first time this family will ever be able to trust the water that they're drinking. And you've just built that for them. And there was something inside of me that happened at that minute that, I had at the time, they're all getting big now, but I had 2 small children myself. And I thought, I can't imagine being worried about the water that my kids are drinking day in and day out and how that might cause their death. And it was a profound moment for me. So, you know, I know you see in Haiti the need, and it's the same in Honduras. I mean, when families have that moment of all of a sudden, they don't have to worry about their children having worms in their bellies. They don't have to worry about their kids drinking water that has cholera or heavy amounts of E. coli in it. And their kids get to be kids, and family members get to be family members, and work and life has a new hope to it. And I've seen that time and time again visiting these different families, and it changes you. It changes me. So so I feel really grateful that I have the opportunity to be able to be a part of that.
Well, it was just beautiful, Natalie. I have a young son myself, and I also just can't even imagine the uncertainty that the people around the world still have to live with. The statistics you cited at the beginning about how many billions of people still live without unsafe water is just so striking. It shouldn't be, right? In this day and age, but the work you're doing is just so important. And I'm really struck by how much of it is behavior change too, because it's about so much more than just a water filter. The water filter is a key component for sure, but really the education and behavior change is a whole different level of involvement and strategy that goes so far beyond just what Dr. O was talking about in the past, kind of the mentality that you just go in and drop off your supplies and as like some kind of donation. It's so much more than that. And I mean, certainly behavior change is something that always takes a long time, and continued involvement. So yeah, thank you again for all the work you're doing. It's truly amazing.
It really does.
Lives.
Well, thank you for allowing me the opportunity to share.
Oh, it's such a pleasure.
Yeah, no, I was just going to say on the behavior change piece, I think about how long it takes us to change a behavior, right? So, if we're trying to change something, it takes time and repetition, right? And so one of the silver linings, if you will, of this current reality is that the understanding of donors to the importance of hygiene education has been elevated, right? So people now understand why is it so important that we spend time teaching people how to properly wash their hands. Why is it that we have to teach them about, how to have good sanitation practices at home? Aren't these things that they just know? But the truth is they don't, because they haven't had access to this. And so it's not passed down. Their mom didn't teach them to wash their hands like we teach our children and we've been taught from our moms. But boy, my sure hope, and when I say it's generational, is that the moms of today that are learning from us are teaching their kids, and their kids are teaching their kids. And all of a sudden, just like we have in the United States, we've transferred these skills through generations, and they'll have the ability to transfer these skills from generations because they'll know them, because all of a sudden it's a known entity as opposed to something they've never had to really think about. So.
Very powerful, have many benefits down the line. So yeah, thank you again, Natalie, for joining us today. It really is amazing hearing about your work, and we'll certainly share this online too with our other club members and guests who can learn from you as well. Is there anything else?
Thank you.
Yes, thanks. Anything else you want to add before we wrap up today?
No, just thank you.
Well, thank you again for having us. And if any of your club members have questions or want to get involved, again, I can't offer the trips today, but boy, those trips are really fantastic when you have the opportunity to do that again. But anybody is welcome to contact me directly. Give us a call, let us know how you want to be involved in any way. We appreciate the support and the ability to get our word out, and any involvement that you want to do, we're happy to make it happen. So
thank you very much.
Well, thank you. And Logan, safe travels to Haiti.
Thank you so much.
All right. Well, thank you again for having me.
Oh, it's a pleasure. Thanks too. Bye-bye.